Imagine your brain, a complex network of neurons suddenly under attack. Blood vessels get blocked, cutting off vital supply. This is a stroke, a medical emergency where every second counts. Understanding the causes, symptoms, and prevention strategies can significantly reduce your risk and equip you to act fast in an emergency. A stroke occurs when the blood supply to a part of the brain is interrupted, depriving brain cells of oxygen and nutrients. This can happen in two main ways: ischemic stroke and hemorrhagic stroke. Ischemic stroke, the most common type, is caused by a blockage in a blood vessel supplying the brain. Hemorrhagic stroke happens when a blood vessel in the brain bursts, leaking blood into surrounding tissues. Recognizing the signs of a stroke and seeking immediate medical attention is paramount. Time lost is brain lost. A stroke, often called a brain attack, occurs when blood flow to a part of the brain is interrupted. Strokes are broadly categorized into two main types: ischemic and hemorrhagic. Ischemic strokes, the most common type, occur when a blood vessel supplying the brain becomes blocked, often by a blood clot. Hemorrhagic strokes happen when a blood vessel in the brain ruptures, causing bleeding into the surrounding brain tissue. Ischemic strokes occur when a blood vessel supplying the brain is blocked, usually by a blood clot. These clots can form in the heart due to conditions like atrial fibrillation or through atherosclerosis, where plaque builds up inside the arteries. The effects of an ischemic stroke depend on the location and size of the blockage. Time is of the essence when it comes to treating ischemic strokes. Treatment often involves medications to break up the clot or surgical procedures to remove it. Hemorrhagic strokes occur when a weakened blood vessel in the brain ruptures, causing bleeding into the surrounding brain tissue. This bleeding can be caused by uncontrolled high blood pressure, aneurysms, and arteriovenous malformations, AVMs. Hemorrhagic strokes are serious medical emergencies that require immediate attention, and treatment often involves surgery to repair the ruptured blood vessel and control bleeding. Stroke, a leading cause of death and disability worldwide, occurs when blood flow to a part of the brain is interrupted. Ischemic strokes occur when a blood clot blocks an artery supplying blood to the brain. Hemorrhagic strokes involve bleeding in the brain due to a ruptured blood vessel. Identifying the specific cause of a stroke is essential for guiding treatment decisions and preventing future occurrences. While some stroke risk factors are beyond our control, our lifestyle choices play a significant role in influencing our susceptibility. Smoking is a major risk factor for stroke as it damages blood vessels. Diet also plays a crucial role in stroke prevention. A diet high in unhealthy fats and cholesterol can contribute to high blood pressure and atherosclerosis. Conversely, a diet rich in fruits, vegetables, whole grains, and lean protein can help lower blood pressure and improve overall cardiovascular health. Certain medical conditions can significantly increase the risk of stroke. High blood pressure is a major risk factor for both ischemic and hemorrhagic strokes. Diabetes also significantly increases stroke risk by damaging blood vessels. Atrial fibrillation, a type of irregular heartbeat, increases the risk of blood clot formation, leading to ischemic stroke. Managing these conditions is crucial for mitigating stroke risk and promoting overall health. Recognizing the symptoms of stroke and acting quickly can make a world of difference in outcomes. Common symptoms include sudden weakness or numbness on one side of the body, drooping of the face, arm weakness, or difficulty speaking. Another symptom is a sudden onset of confusion, trouble speaking, or difficulty understanding speech. Other warning signs include a sudden severe headache, dizziness, loss of balance, or coordination problems. When a stroke occurs, the immediate effects depend on the location and extent of brain damage. A stroke affecting the left side of the brain may result in paralysis or weakness on the right side of the body and speech difficulties. Conversely, a stroke affecting the right side of the brain may cause paralysis or weakness on the left side of the body and visual spatial problems. Prompt medical attention is crucial for minimizing damage and maximizing the chances of recovery. Time is brain, the urgency of medical attention. Stroke is a time-sensitive medical emergency. Every minute counts as brain cells deprived of oxygen begin to die rapidly. The faster blood flow is restored to the affected area of the brain, the better the chances of minimizing damage and improving long-term outcomes. Think of it like a fire. The quicker you extinguish it, the less damage it causes. If you or someone you know experiences any of the warning signs of stroke, it's crucial to call emergency services immediately. Don't wait to see if the symptoms improve or try to drive yourself to the hospital. Time lost is brain lost, and prompt medical attention can make a life or death difference. Upon arrival at the hospital, the medical team will act swiftly to assess the situation, determine the type of stroke, and initiate appropriate treatment. For ischemic strokes, treatment often involves medications to break up the clot or surgical procedures to remove it, restoring blood flow to the affected brain region. Hemorrhagic strokes, on the other hand, require different interventions to control bleeding and relieve pressure on the brain. This may involve surgery to repair the ruptured blood vessel or medications to lower blood pressure and prevent further bleeding. The key takeaway is that time is of the essence. The sooner medical professionals can intervene, the better the chances of a positive outcome. Emergency response, first line of defense in stroke. A stroke is a medical crisis demanding immediate action, much like a house fire where every second counts. The moment someone exhibits stroke symptoms, a rapid response is critical for minimizing brain damage and improving outcomes. The first line of defense involves recognizing the signs and swiftly contacting emergency medical services. Remember the acronym FAST, a simple tool to identify stroke symptoms: facial drooping, arm weakness, speech difficulties, and time. If any of these signs appear, don't hesitate. Call 911 or your local emergency number immediately. Emergency medical technicians, or EMTs, are trained to provide immediate care and transport stroke patients to the hospital quickly. They may administer oxygen to ensure adequate brain oxygenation, monitor vital signs like blood pressure and heart rate, and initiate basic life support measures if needed. Upon arrival at the hospital, the stroke team swings into action. This team, often comprising neurologists, neurosurgeons, nurses, and technicians, works collaboratively to assess the patient's condition, determine the type of stroke, and initiate appropriate treatment as quickly as possible. The mantra "time is brain" underscores the urgency of this phase, as prompt intervention is crucial for minimizing brain damage. Targeting the clot treatments for ischemic stroke. For ischemic strokes, the most common type, treatment focuses on restoring blood flow to the affected brain region by breaking down or removing the blood clot obstructing the artery. One of the most effective treatments in this scenario is a clot-busting medication called tissue plasminogen activator, often referred to as alteplase. Administered intravenously, TPA works by dissolving the clot and restoring blood flow to the brain. Think of it as a powerful drain cleaner, breaking down the blockage in a clogged pipe. However, this medication must be administered within a narrow window of time, typically within 4.5 hours of symptom onset, to be most effective. This emphasizes the critical importance of seeking immediate medical attention when stroke symptoms arise. In cases where TPA is not suitable or ineffective, mechanical thrombectomy may be an option. This minimally invasive procedure involves inserting a catheter, a thin tube, through an artery in the groin and guiding it to the blocked artery in the brain. Once in position, the catheter deploys a device that either removes the clot directly or delivers a clot-busting medication directly to the obstruction. Imagine a tiny vacuum cleaner navigating through the intricate network of blood vessels to reach the blockage and remove it, restoring blood flow to the starved brain tissue. Mechanical thrombectomy has shown promising results in improving outcomes for patients with large vessel occlusions, particularly when performed within a 6-hour window from symptom onset. Managing hemorrhage, addressing bleeding in the brain. Hemorrhagic strokes, while less common than ischemic strokes, pose a different set of challenges and require distinct treatment approaches. Instead of breaking down a clot, the focus shifts to controlling bleeding, reducing pressure on the brain, and preventing further complications. This often involves a combination of medical management and surgical interventions. Medications play a crucial role in stabilizing the patient's condition and mitigating the effects of bleeding. Antihypertensive drugs are used to lower blood pressure, reducing the risk of further bleeding. Antifibrinolytic medications, on the other hand, help control bleeding by promoting blood clotting. Imagine these medications as a team of skilled plumbers working tirelessly to repair the burst pipe and prevent further leakage. In some cases, surgical interventions may be necessary to address the underlying cause of bleeding and relieve pressure on the brain. For aneurysms, which are weak bulging spots on blood vessel walls, surgery may involve clipping the aneurysm to prevent rupture, or coiling, a minimally invasive procedure that fills the aneurysm with tiny coils to prevent blood flow and promote clotting. Surgical evacuation of the hematoma, the collection of blood outside the blood vessels, may be necessary to relieve pressure on the brain and minimize further damage. This delicate procedure involves removing the accumulated blood to allow the brain to heal and reduce the risk of long-term complications. The decision to pursue surgery depends on several factors, including the location and size of the bleed, the patient's overall health, and the potential risks and benefits of the procedure. Taking charge lifestyle changes to prevent stroke. While some stroke risk factors are beyond our control, like age and genetics, many are modifiable through lifestyle changes. Just as a well-maintained car is less likely to break down, a healthy lifestyle can significantly reduce your risk of stroke. Empowering yourself with knowledge and making conscious choices can pave the way for a healthier, stroke-free life. One of the most impactful steps you can take is to quit smoking. Cigarette smoke damages blood vessels, making them more susceptible to narrowing, hardening, and clot formation, all recipes for stroke. Think of it like removing a ticking time bomb from your system. Quitting, even after years of smoking, benefits your health immediately and in the long run. Regular physical activity is another cornerstone of stroke prevention. Exercise helps lower blood pressure, improve cholesterol levels, control blood sugar, and maintain a healthy weight, all crucial for a healthy cardiovascular system. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Think of it as investing in a robust security system for your brain. Diet plays a pivotal role too. Reduce your intake of saturated and trans fats, cholesterol and sodium, all culprits in raising blood pressure and cholesterol levels. Instead, embrace a diet rich in fruits, vegetables, whole grains, and a lean protein. Think of it as providing your body with premium fuel for optimal performance. Medical management partnering with your doctor for stroke prevention. Partnering with your doctor for regular checkups and medical management is crucial for stroke prevention. This is especially important if you have conditions that increase your stroke risk. High blood pressure is a major risk factor for stroke. Regular monitoring and medication can help keep it in a healthy range. Diabetes also significantly increases stroke risk. Manage your blood sugar levels through diet, exercise, and medication. If you have atrial fibrillation, your doctor may prescribe blood thinners to reduce stroke risk. Regular checkups allow your doctor to monitor your health and recommend strategies to mitigate stroke risk. Prevention is better than cure. A proactive approach is the best defense against stroke. Empowering ourselves. A future beyond stroke. Stroke, often called a brain attack, can have lasting effects. Understanding its causes, symptoms, and prevention helps us take charge of our brain health. Lifestyle choices like a nutritious diet and regular exercise are powerful weapons against stroke. Managing conditions like high blood pressure and diabetes is crucial for minimizing stroke risk. Knowledge is power. By understanding stroke, we advocate for our well-being and that of our loved ones. Embrace healthier habits and a holistic approach to health for a future filled with vitality and well-being.